A group B strep is a bacteria that we know can just live on the skin in the vaginal and rectal areas for some ladies. It's just a natural part of what lives down there on your body. Some ladies will have it at some times of their life and not other times, and so what we do is we check for it at the end of pregnancy because we know that it can cause an infection for the baby at time of delivery. There's a lot of good research showing, though, that if we give antibiotics, if you happen to have group B strep, that it's safe to proceed with a vaginal delivery for the baby. And so that's why we recommend screening for everyone to see if the antibiotics are necessary. Even if you're planning a C-section, they still recommend we get the screening, just in case something happens, like your water breaks, it's gonna take a few hours to get back to the OR for whatever reason. We might give antibiotics sooner rather than later to help protect. We do see that some ladies will lose their mucus plug and not truly be in labor at that point. Labor is a little hard to determine sometimes. It's one of those things that if your contractions are getting close together, that's when we know that it's time to get it checked out. If you're having regular contractions and you lose your mucus plug, then you can monitor for other symptoms as well, but it might be a good idea to consider coming in if you're having those regular contractions. The symptoms of labor tend to be regular painful contractions. And so once they're getting close to about 5 minutes apart, that's usually when it's going to be regular, routine labor. To know for sure, we have to do a vaginal exam to check to see if the cervix is changing with the contractions. And that's how we can deem that it's truly labor. However, if you're getting those regular painful contractions, we do recommend coming in. If you're getting a lot of bleeding with the contractions, we do recommend coming in. It can be normal to get a little bit of bloody show, but if it's getting kind of heavy, and especially if the baby doesn't seem to be moving as much, we'd want you to come in for evaluation. The other thing we look for is, does it look like maybe your water broke? If you get a big gush of fluid, come on in so that we can monitor, especially if you're group B strep positive. That way we can get those antibiotics started. The other thing too with the leakage of fluid, sometimes it can be a slow leak. So if you're noticing that your underwear is always damp, then you might want to come in so we can check for that. I recommend going to the hospital whenever the contractions are about 5 minutes apart, or if you have broke your water, or if the baby's just not moving well through the contractions. In labor, we have a lot of options for pain control. Starting from just kind of basic, we just want to kind of relax your body. So we do have medical grade aromatherapy that we can use. We do allow you to labor in a tub. A lot of the rooms do have tubs to allow for that. We just have you get out at time of delivery. And then we also do things on the unit, like they've done some studies where just holding a comb in your hand and pressing on it redistributes kind of that pain focus, and so for ladies that can help through the contractions. So we have those options. We do also have the option to use nitrous oxide gas, which is like the laughing gas. You just breathe it at time of the contraction to take the edge off the contraction. It does get passed to you and baby, but the effects are very quick, that the moment you bring it down, then everything's fine. So there's very little harm to it. And then we do offer IV push pain medications if we need to, especially if we're trying to stave off the epidural for a little bit. With the IV push medications, they do get transferred through the placenta to the baby, and so we watch the baby's heart tones, make sure everything's fine. It usually goes well. It's just we want to make sure it's out of the baby's system before delivery. Otherwise, then the baby doesn't want to take those nice deep breaths. Although we can support the baby, nobody likes to be in that situation because everybody gets a little worried. So as long as you're about 2 to 3 hours from when we think you're going to deliver, IV push medications are still an option. And then we do have the epidural. The epidural does give a really good pain control for a lot of patients. We can't guarantee that it gets rid of all the pain during labor, but it tends to be one of the better options. None of it does get passed to the baby. It's all in your spinal space, so it's very safe for the baby. It can, however, drop your blood pressure sometimes, and so we give fluids in order to counteract that. If your blood pressure drops, then we watch the fetal heart tones. Sometimes they'll react, and often by just treating your blood pressure issue or repositioning, we can go on to have a nice normal labor. Rarely does it lead to something where we have to do an emergent delivery, but that is always a risk that's there, so I do like to mention it. When you come into the hospital for delivery, we recommend that you make sure you bring in your insurance card, all necessary, paperwork in order to get checked in. You also just want to make sure that you have those toiletries you'd like to have. We do have some available that if you are rushing out of the house and you forget your toothpaste or your toothbrush, we do have those things we can give you, but it's nice to have your own. Any, hair, makeup stuff you want in case you do want to look nice I know they do the newborn pictures. I don't think they include the mom in them, but just pictures with anyone who comes by. Having a robe and a nice pair of slippers so you can navigate through the room is nice, especially for after delivery too. I often recommend bringing your own pillow if you have certain pillows you like. They're not the most comfortable beds, so you can prop yourself up with pillows, your favorite blanket, that's fine. The other thing is our towels are really rough, so you might want to bring your own towel if you are like me and you like to just be a little cozy. As far as for the baby, they'll have all the basic needs for baby, like the diapers and the wipes, and if you need to formula feed, they do have formula here. But it's nice if you are going to breastfeed to bring your breastfeeding pillow, any outfits you'd want to use for newborn pictures. Would be fine to bring. And then for your partner, if somebody or your support person, if they're going to stay the night, the room's rather large. We just don't have a really good place for them to sleep. So even like a little blow-up mattress, twin size preferred, but queen can fit in the room, might be nice for him or her, whoever's staying with you.